Hi, good evening, everyone. This is indeed a pleasure for me to introduce to all my viewers a wonderful, wonderful lady who has achieved such a brilliant result in the exam. And I'm very pleased to introduce to all of you Dr. Kirti. She is going to be introducing herself, and Dr. Kirti has managed to get a very decent rank of 6,298. This was in spite of the fact that she had completed her internship. And in that sense, this was her maiden attempt when she was appearing for this NEET PG exam. So many congratulations, Dr. Kirti, to you and your family members for this wonderful result.
Thank you so much, sir. Good evening. Myself, Dr. Kirti. I have done my MBBS from MVJ Medical College, Bangalore. It's a private medical college. And after finishing internship, I subscribed for Cerebellum. And after that, it was just like I was into the process, and paper got postponed again and again. It was a very, mental, not a very good space to be into. But I think Cerebellum just pushed us to the last day and just got over.
Okay, I think Dr. Kirti is being very modest about her own efforts, and obviously, we as a team would always be there to help the students and acting as catalysts. But one of the best things that I find is that this year, particularly, a lot of people from private medical colleges have really aced the exam, and I would really like to congratulate each one of the students who have done so. So, Dr. Kirti, according to you, do you think there is some kind of a myth around the fact that students from private medical college either they are not able to clear the exams or do they not study well enough to clear the exams? Is that so?
Sir, I don't think so that the fact is true that they don't study. I think there is a very huge amount of, the thing that there is no support and no proper guidance during the college thing. There was like we just thought that we just have to pass the prof exams and just have to done with internship, and after that we would just see and prepare for the exam. But I think what is very important is to understand that it's not that difficult. Once you what is important is to decide what you have to do, and most importantly what you don't have to do. For
Agreed.
example, it is very important nowadays, the questions are being very clinical, and it is important that you have to read the notes properly, you have to solve questions and give as many GTs as possible. I think if anybody, doesn't matter that if you belong to a private medical college or a government medical college, if you are doing the process in the right direction, you would be just getting a good result at the end.
Absolutely. So I think Dr. Kirti and a lot many people who have achieved the good results of the exam have shattered that myth that people from private medical colleges cannot do it. It is just about the right guidance, the right amount of discipline and the hard work which is required. And obviously, Team Cerebellum is always there going to be pushing you harder for achieving the same. So what was the exact resource, or how did you when you start your preparation? Exactly when was this? And what was the main thing that you referred to, Kirti, with respect to Cerebellum's, different things which are available?
So from second year, I have studied notes of you, Vivek sir, Govind sir, Zainab ma'am. And
Okay.
when I, after finishing my internship, when I saw that everybody is coming together on the single platform, I was very happy actually. I
Okay.
subscribed, and then after that, what I thought that I already did the main notes from second year. I used to study from your notes for the prof exams. So I started with RR, and then I combined BTR for every subject, and eventually I just integrated everything into my BTR book, and that was the thing. And I gave all the ENDs, GTs, whatever was there on Cerebellum. And
No, you said that very important component in a very feeble voice, the contribution of the grant tests and the ENDs. So a lot of your juniors would actually be following you, right?
yeah.
People would love to copy you with respect to the result that you got, or maybe even better. So what do you think is going to be the role played by appearing in those tests or the END discussions, and how did it help you?
So I think for any competitive exam, there are two pillars. One side is the content which you do, and the another side is the amount of questions which you solve. And I think that it is very important that it's okay if you are studying less, but you have to solve like a good amount of questions if you want to get a good result.
Hanji.
So what I thought when I was preparing was that it's okay that if I'm doing RR, but I gave all the ENDs, and in the last 1 year, I think maybe I would have like gave around 30 or 35 GTs.
Okay, wonderful.
So I think that it is very important to give GTs, because that is the only way that you can assess yourself that if I am doing the process in the right direction, that's the only way.
हाँ जी, हाँ जी। नाउ अच्छा, एक और एक बात बताओ, मतलब दिस ईयर द एग्जाम वाज एक्चुअली अ रोलर कोस्टर राइड, यू नो,
Yeah,
इट वाज changed, the date was changed, and then subsequently we saw the postponement and then two shift exam, so many reasons. So a lot of people may not have have achieved the result that they desired, so
yeah.
people would be preparing for it, as well as there are people who are going to be freshers, right? What is your strategy or what is your advice to them to maintain sanity or mental health when you're preparing for an exam? It's a very low phase actually. There's
Yeah.
nobody supporting you. You are a 24-year-old, 25-year-old adult. You don't want to take money from your parents. Then natural pressures of the exam. In some subjects you are doing good, some you are not doing that good. Your friends are away. So how should somebody manage that mental pressure, or how should somebody take care of their mental health?
So this year, like paper was postponed, preponed for around like 4 or 5 times.
हाँ
Of
जी,
course, first time even I lost it. Like, what is this? How am I gonna do? How am I gonna study for again for 3 more months?
हाँ जी,
But I think that on the same day, Zainab ma'am posted one video, and the entire team was texting on the Telegram group that now it is it. Like, you have to live with it. You have to accept it. I went to my parents. I just talked to them, and that is, I think, the drug of choice, that you just talk to your loved ones, talk to your parents or friends, and just accept it. And of course, like for 3 4 days, I lost my momentum. I was not able to study, but after that I just thought that I have no choice. I have to study. People are going to study. There is a huge competition. So
हाँ
I
जी,
think acceptance is very important, to accept and move on, rather than cribbing on the same point that it is postponed. It is same for everybody. So I just accepted and talked to my parents, and I'm very lucky that my parents were always there and they just sat with me. I remember the day paper got cancelled on the same night. My parents got to know in the night itself, but they didn't wake me up. They
okay,
told me, they informed me in the morning, and my dad was like, "You just sit down once. What if your paper get postponed?" I was like, "Why are you saying all this like in the morning to me?" He
हाँ
was
जी,
like, "It is cancelled. You have to like accept it." And then we went out for like the whole day, chilled out, and came back. And I started studying from the next day itself, because I knew that paper is going to happen. It's not like it's been cancelled forever. So
right,
I think, and yeah, of course, the Cerebellum team have helped all of us at every step. That after every postponement, there was a particular plan which I have followed, and I think that is very important, that you get a structure.
right,
Because being a student, it's not that we are always motivated,
हाँ जी,
and it's very difficult to be disciplined forever.
right,
When we make schedule by ourselves, we feel कि अरे ठीक है कल कर लेंगे कोई बात नहीं. But when we get a structure कि भी 4 ही दिन है, on the 5th day you have an END, and of course we have to study, because we are going to appear in the test, and of course if scores won't be good, then it's sometimes very disappointing. So I think that both the things were there. I had my family with me, my friends, and of course the team with. So it just happened.
So I think a very big shout out to your parents, and thankfully they are mature people, they are sensible people who have supported you. I would pray to all the parents as well that even if your ward has not got the desired result, please don't doubt his or her capabilities. They are definitely going to be doing better. They just need your affection and your support at the time being, right?
Yeah.
Okay. So another thing which came to my mind, Kirti, is we had an introduction of a new concept, which was the late night PYQ marathons.
Yes.
Did you appear in them, and how did you find them? I mean, what's your feedback regarding them?
Sir, my one rule was I'm not going to sleep if I won't be doing any marathon. That was the rule.
Excellent.
That after having dinner, I'm going to solve one marathon and then I'll go to sleep. So that's how I have solved all of them. It's not, I did not even miss one. I solved all of the late night PYQ marathons, and it has helped. Like, after the paper got cancelled on 23rd, I did not solve the PYQs again, because after the cancellation of the paper, I sat on my table and I just thought that what are the regions where I have scope of improvement, and I can perform better, so that I can perform better in the exam.
हाँ
And I
जी,
thought that I actually have that bias of PYQs. Like, if I am gonna appear in any GP, I have that tendency कि अरे ये तो ऐसा PYQ में था, and I have that thing कि let's mark it and move on. So I thought that I won't be solving PYQs, but then again I had that FOMO कि नहीं करे PYQs. So I think marathon have helped me over there, that I was not solving the PYQs subject wise and year wise, but I was just giving it as a test. कि 50 क्वेश्चन दिन के सॉल्व भी हो रहे हैं एंड इट्स लाइक आई वाज एंजॉयिंग देम.
Maybe it also helps your brain to, kind of, जैसे हम बोलते हैं ना, वायरिंग हो जाती है. So
Yes.
that as and when you're appearing in the real exam, तो आपको ऑटोमेटिकली वो कीवर्ड्स, की फ्रेजेस, प्रेजेंटेशंस, वो ऑटोमेटिकली ना आपको ज्यादा दिखने लग जाते हैं. एंड यू सडनली रिमेंबर, डेजा वू फिनोमेना हो जाता है कि अच्छा ये तो उस टेस्ट में था, ये तो उस टीचर के साथ डिस्कशन में बात करी थी.
Yes.
और बहुत सारे स्टूडेंट्स ने ऐसा बताया कि मतलब उनको वर्चुअली ऐसा लगा कि टीचर्स ना अपीयर कर गए. जैसे सर्जरी वाले सर ने कुछ बोल दिया, अच्छा गोविंद सर आ गए कैफे में बाल, ऐसे अतुल सर का कुछ आ गया, ऐसे दिलीप सर का कुछ आ गया. सो लॉट ऑफ दैट हैपेंस विद स्टूडेंट्स. डिड दैट हैपन विद यू एज वेल?
सर ऐसे काफी सारे क्वेश्चंस थे. फॉर एग्जांपल देयर वाज वन क्रोमोफोब आरसीसी क्वेश्चन.
हाँ जी.
आई रिमेंबर यू सेइंग दैट look at this is resinoid nucleus, look at this. So I just, and there was one pharma question, I think that was a tricky question कि aspirin का था कुछ उसमें कि बाकी और NSAIDs भी होते, कुछ ऐसा question था. And I just actually I remember the exact question which was there in the END where Zainab ma'am has explained it very well, and I think that gave an edge in the exam. And yeah, questions are very important. ENDs questions, GTs, it's like the very important thing which people tend to ignore कि कोई बात नहीं, GT 3 घंटा वेस्ट हो जाएगा, 3 घंटा पढ़ लेते हैं. But I think that giving that GT for 3 hours sitting over there is very important.
Wonderful, wonderful. So a lot of people who are watching you now, can you just give a shout out to the people who are your juniors from your college as well as to other people who are watching this particular video, and just kind of tell them that yes, they can also do it, or a couple of lines that you would tell them कि भाई अब कर लो, ऐसा कर लो और हो जाएगा.
So the one thing which is like with me, which my dad has told me very like when I was doing my UG preparation, that time he just told me that study is the only thing when you start, you can like do any miracles in that. If you start today, you can do it. Doesn't matter that you belong to a private medical college or a government medical college. If anybody is preparing, they have to first, it is very important to know what are your positive points, what are your negative points. It's not that you can copy somebody that, oh, that person have done this, so I can just copy that. No, you have to sit and you have to decide what is important for you, what is good for you. And after that, I think if somebody is taking cerebellum, and just follow the schedule, that's it. You just have to attend the classes, you just have to give ENDs, tests, and you'll be okay.
And excellent, excellent. So I think she coming from Rajasthan, I can safely say the fact that her result has been ghana chokha. And we hope to see you in person really soon, as and when there is an opportunity. You coming to this side or we coming to your place,
Sure.
right? Please do convey our best wishes and regards to your family members, especially to your parents, who
Yes,
have been such a wonderful support and, of course, a very critical part in your success.
Yes, sir.
Thank you so much for joining in, Dr. Kirti. Thank you so much.
Thank you so much, sir.
God bless you. Bye bye.
Thank you, sir. Bye.